You are listening to the podcast That's Life in Sweden, or as we say in Swedish, Sånt är livet i Sverige, with me, your host, Lisa Uusimaki. I want to welcome Alexandra Uusimaki, who's an entrepreneur. She's the chair for the Breast Cancer Association Johanna here in Gothenburg, Gothenburg, Sweden. So there's lots to talk about, and let me begin by saying Happy New Year for 2025 and welcome to the program, Alexandra. How are you?
Thank you. I'm good.
Great. Now, I think it's important that I mention from the start that Alexandra is my niece, and you can, if you look at my surname and Alexandra's surname, we have the same surname. So she's my sister's daughter, and it is an absolute privilege to have her on the program. Now, Alexandra, you have had personal experience suffering from breast cancer. Can you talk about how old you were and how the breast cancer was discovered?
Right. I was very young when I was diagnosed with breast cancer. I was 27 once it was discovered, and but I had felt lumpiness going on in my left side, my left breast. I'd felt that for, I don't even know, maybe a couple of years' time. At the time, my daughter was just over 2 years old, and I believe that it started somewhere around during pregnancy. But at the time, when I felt the lumps, I was sort of, just brushing it to the side, thinking that, well, obviously there's going to be things happening to the body, going through, a pregnancy. There's a lot of things happening. And then I looked at did a quick Google search, found out the statistics, found out how incredibly rare it is to be under the age of 30. And that sort of put my mind to rest for a long time. So when I actually did finally go to see the GP and to say that, look, I have a lump, I do think it needs to be checked out, I'd already sort of suspected something for quite a long time.
So what happened? It was discovered, and what was your initial thoughts?
Well, initially, the process here in Sweden is you go to the GP, and they, if there's a lump that they don't have any kind of clear other explanation to what it is, it has to be evaluated. And what they do is they send you off to a specialist where you do a mammogram. That's the first point of check. And then after that, you might do an ultrasound. And if they still can't really, rule out that there's anything malignant, then they do a punctuation, they do a small biopsy and look at it. And the problem with younger women is in young women, you have a high breast density, which is very normal, and it usually goes away by age. But the younger you are, the more dense breast tissue. And the problem with that is that it's very difficult to see anything with the mammogram. The mammogram is a fantastic machine. It's a fantastic way of diagnosing breast cancer, but not in all patients, and especially not if you have dense breast tissue. So in my situation, they didn't see anything clearly on the pictures. They didn't see anything clearly on the ultrasound. And they also managed to not punctuate the actual invasive tumors. They missed those, and they thought initially that I had something called pre-cancer, that it was like a pre-stage of invasive cancer, which is the least severe type of breast cancer. And the fact that it was actually invasive and that it had spread to the lymph nodes was something that I only found out after surgery.
Wow. And what was your initial thoughts? I mean, your daughter was 2 years old?
Yeah, I mean, obviously there's a lot of panic going on, and you tend to have very dark thoughts, always everything goes to the extreme, what's going to happen if I don't make this? What's going to happen if I don't survive? Who's going to look after my daughter? Even more so because she's born in Australia and her biological father lives over there, but we haven't been in contact since she was only a few months old. And my thought was, what if he turns around and says, I would love for Sophia to come and live in Australia? That would have been, disastrous. So I had a lot of worries on what was going to happen with her. And what was the next step,
And of course, that's really important. And I'm also thinking that my younger sister or your auntie actually passed away because of breast cancer, and that was then related to what was found was hormonal cancer, because she was so. We don't know for sure, but
most breast cancers are hormonal. That's like 75%, 80% of all breast cancers have an hormonal trigger. We know that. That's a fact. So most women have that, but it's still something that's very rare to get when you're younger. It's usually something that appears that it takes quite a long time for those tumors to grow, and that's why it's more common once you're 50, 60, 70 years old.
And she was, of course, under the age of 40.
Yeah.
So yes, it was a shock to the entire family. I can just say that not only when our sister passed away, but then Alexandra was diagnosed with breast cancer.
Yeah, and also not just that. I mean, obviously we had my aunt who died, but I also had my youngest sister who had just passed away a few years earlier. So speaking to my mom, she was the worst person to speak to, really, because I felt like she had already buried one daughter a few years before, and so her worry was all about her, which in a way was, I can understand that, it's very human, but it wasn't helpful to me.
No. And yes, exactly. It was dark times.
We've had a lot going on. Emily, what's happening here, Lisa? Let's start the
know.
new year on a new...
Yeah, no, we are going to... But I think it's really important to hear a story like this, because there are young women who may be listening, and they may be suspicious that, not everything is as it should in our bodies. And I think it's important to talk about it. And so, hey, I really appreciate this conversation, considering it has taken time for us to even to speak about it. We all hear about the Swedish nursing, hospitals, medicine, one of the world's best. So I'm just curious about your experience with the care you received from the doctors and nurses. Did you find at the time that there may be something missing?
Yeah, well, there was a lot of problems in the care that I received, and I mean, obviously, you know this, Lisa, because you've been involved in the process as well, and there were so many faults happening. We do have a high level of care in Sweden, but it doesn't mean that it's always so well organized. Even if you have a budget that is paying for medical treatments, we don't have, anyone in Sweden is entitled to medical attention and medical care. It doesn't cost you anything, that it's all subsidized, but it doesn't mean that it's always organized in the best way. And I think even more of a problem occurs when you have a specialized diagnose, because then you don't only get to see one doctor or two people. There's so many different parts of a breast center or a hospital, so many different specialists that are involved. You got your pathologist, you got your breast surgeon, you got your oncologist, you got the plastic surgeons, you got the genetics department. There's so many different areas involved, and the more people that are involved, there's a higher risk of something going missing in each overlap. There's a risk of something happening, and that was exactly what happened in my case, which unfortunately led to a lot of poor decisions being made. And I think as well, the diagnosis is something that is very, very crucial, and we all know this, that the profession is very well aware that having a proper pathologic diagnosis at the start, having good imaging and to really be able to diagnose what type of cancer you have is crucial, because it can impact all the next steps.
Absolutely, and not to mention next person in line. Yeah. So even if so in your case, and I do remember, and I thought it was very stressful. I found the whole process very stressful, and like you said, there are many specialists involved, and sometimes you can have too many, and it's kind of lacking. And also I'm thinking your perspective as the patient, because I'm not an expert on breast cancer, so I have to listen to the advice.
And you get, it's always down to, depending, it doesn't matter how much of a professor or academic you are, it's always down to the person that you are as well. And some people are compatible, some people are not. Some people are very good at listening and some people are not. And I think being very good at listening, being empathetic, being good at reading other people might not be skill sets always found in specialists. You know, once you become a professor or you're very, you know, qualified in a specific area, those might not be your key points. And the thing is, in Sweden, we do have patient laws that requires, and it's something that's very central to all the different documents, all the different rules, all the different health protocols, that it's always the patient first. You know, putting patient first, patient's needs, but also patient's preferences. It's not something, the doctors don't decide what treatment you have. They give you an offer of treatment. They give you an offer. They give you a proposed treatment based on their expert knowledge. But it's not the same as saying this is what you're going to have. They don't get to decide. And I think as a patient in that situation where you're so scared of a million other things happening, you might not be an expert yourself. It's very, very easy to be talked over and to be pushed into things that might not be in your best interest.
You know, I found it was astonishing to find that there are 9,000 women here in Sweden only last year who were discovered with breast cancer. Now, you have an interest in the actual research into breast cancer. Do you have any ideas why, or do you have any ideas how many women we actually lose to breast cancer?
Yeah, it's about, I think last year we've said it was about 1,500, nearly 2,000 that died due to breast cancer. And there's a lot of women who are currently living and who lives past 10 years, but who dies maybe year 13, 14, 15. And most statistics is based on either 5 or 10 years. So you're looking at a 10-year survival rate, which is very good in Sweden. We're almost at 9 out of 10 women that live to 10 years. But there's a lot of statistics there that goes, because breast cancer can reoccur and come back much later as well.
And how long have you now been? You kind of recovered now?
Yeah, I don't have any known disease.
Mm-hmm.
So yeah, it was 10 years last year, going into year 11 now, because it was in 2014 and we're just entering 2025.
Yes, going strong.
Yeah.
So also, I'm curious about what is happening with research when it comes to breast cancer or elimination of breast cancer. Do you think that's ever possible?
Yeah, I do. And a lot of the experts are also very, very hopeful when it comes to the future, that we're looking at a future in maybe 40, 50 years. People won't get breast cancer, or at least they won't die from it. That's the vision, and I do think it is possible. A huge part of it is down to lifestyle factors and how you can actually, you know, minimize the risk of getting breast cancer. There's a lot of research being done on individual factors, such as, do you have a genetic mutation? By knowing more about our DNA, we can find which women have a genetically predisposition for breast cancer, and we can take steps to avoid that from happening. And also a lot of research and a lot of work is done to diagnose people early, because early detection is the number one most important factor.
Now, talking about early detection, I'm just thinking about, if you said about 1,500 women die, are there statistics how many were under 25 or 30?
Yeah, I mean, we do have a very extensive cancer statistics program in Sweden. You can find a lot of data, so all of that is very, very closely monitored. And when it comes to women under 30 in Sweden, it's about 10 people per year out of those 9,000. So we're not even talking, promille, very, very small numbers. But in general, the younger you are, you tend to have a more aggressive breast cancer. And a lot of young people tend to have worse prognosis. That's still the fact. And it's the fact not just in Sweden, but in all of, the Western world.
Now, you also mentioned about the genetic factors, but in your case, and even in are your aunties or my younger sister, there is no breast cancer in the family.
Yeah, well, what they do is if you are diagnosed with breast cancer and you're under 40, you automatically get sent to do a genetic testing, because that suggests that there is something going on, because it is very rare. I did a genetic testing. They didn't find any of the genes, but that doesn't mean that there isn't any genetic composition there, because we've only just touched the subject, like the surface of, trying to find all the genes. There's billions of genes, and we haven't mapped out more than just a few of those. So just because we're able to eliminate the 11 or 12 genes that we know, just because they weren't any kind of mutation in any of those, in my case, it doesn't mean that I don't have genetic cancer. But in general, it's not. Most cancers are not genetic. It's about 5 to 10% of all diagnoses. Out of those 9,000 women per year, we say that a high number would be 10% of those have a genetic
disposition.
Yeah.
And what about, you also talk about how women, there are lifestyle factors. Does this also include young women? I mean, you were healthy and there was nothing wrong with you, and suddenly, or was it sort of then kind of related to pregnancy?
No, I mean, when you look at lifestyle factors, I would say this is something you have to apply on a group level. You cannot look at it as an individual and say, this is what happened and this is why this happened. This type of statistics and studies has to be done on a group level. That's why it has to be enforced on a national or international level when it comes to health and health guidelines, medical guidelines. We're talking about food, we're talking about exercise, we're talking about alcohol. Alcohol, we know, is a big factor, but when you get it at that young of an age, I would see, for my own sake anyway, that it's unrealistic that I would have been able to do something myself, that I would have been able, with the partying, with the young lifestyle that I had, that would have been enough to create this cancer. I don't think so, but I don't know. Let the professionals speak. I've never been like zero alcohol, but I've never been, having a problem with it either. So,
what about now? I know you're part of a research team at the Sahlgrenska University Hospital. Can you talk about that?
Yeah, I mean, in my current position, when I'm a patient advocate and I am the head of the local breast cancer association here in Gothenburg, we do try to speak with different research teams, hospitals, guidelines, as much as we can to provide our view from a patient point of view. And there's one study right now that me and two of my board members are co-authoring together with Sahlgrenska, which is a study that is looking at different various types of plastic surgery and how you can do different types of operations. And in my case, I think it's very, very important to get some sort of real data showing that there are multiple ways that you can do reconstructions, and that also factor in the patient's preferences, the individual preferences, individual motivations for certain things, because it's not just to do with a strictly aesthetic result. It could also be down to maybe you are happy with trading down an aesthetic result for having a quicker, time, a slower time in the hospital or an easier recovery. Whereas for someone else, you need to have, we all have different preferences, and especially when it comes to aesthetics.
Absolutely. Now, you just mentioned you are the CEO for the Breast Cancer Association called Johanna here in Gothenburg. How did that come about?
Well, the Breast Cancer Association here and all the breast cancer groups in Sweden, they are all acting locally, and they all have volunteers working. It's a network of women who have had breast cancer. Some of them are chronically ill, so they still have it, and some of them have recovered and had it in the past. And there's quite a few volunteers as well that are just, relatives and friends and close family and such. And I don't know how it came about that I was made, president or chair, but it's one of those things that's sort of grown organically. I joined up as a member once I had my diagnosis, went to a few meetings, wasn't very active for the first few years because I had so much else going on in my life. I didn't need the support myself. But then I realized that, okay, the cancer group isn't so much about, fine, if you need help at an early stage, great, that's what we want to be able to provide. But if you are not a person that needs help yourself, maybe once it's been a few years, it can be very rewarding to find something that you can do to help others. And that was sort of my key take, that it was a few years had passed and I realized that, hey, I've got this experience and knowledge in many areas. Maybe I could do something here. Could I step in and be a part of the board? And so I started as a board member. I did that for a few years, and then the opportunity arose, and I was voted in. So it's something that I'm voted in each year at an annual meeting.
And I found it was really fascinating too, because I remember early days you were not really keen on talking about the experience.
No, I was pissed off. I was angry.
Oh, okay.
Am I allowed to swear on this?
Absolutely.
Don't need to hold it in then.
Don't hold it, better out than in. But yes, I remember, and I thought to myself, she's actually joined a breast cancer. You were probably ready to talk about, ready to get involved. Like there's something.
Try and provide as much support as we can. We have a telephone number that you can call, which is staffed by volunteers, local volunteers, and we have a schedule where if someone's in charge of the phone line this week, next person next time. There's meetings that we arrange on a weekly basis. There's specific meetings that we have a few times a year for brand new members. We arrange all kinds of, both social activities that are just, a fun thing to do. But we also invite different speakers and researchers and the medical profession to speak about certain topics. We have a therapist that is linked to our association, and she holds, group therapy sessions and individual sessions, and we do that quite a lot. So if you are in need of help, we are very, it's important to say that we're not medically trained, we're not medical professionals, that's not our role. But what we do is we are people who have gone through this ourselves. And if you go to one or two of those meetings, you might find yourself talking to another visitor, someone else is there. You swap numbers, you go for walks, you have a coffee together. I think it's very important sometimes to find support outside of your family and outside of the medical profession, and that's what we're trying to provide.
Last year you were nominated, and then you received a very prestigious reward in Sweden. It's nationwide, and in Swedish it's called eldsjäl. Now, try to figure out the English translation, and I'm thinking, what on earth would that be? Because it wouldn't, if you translate directly into English, it doesn't say very much. But I was thinking about it, and you mentioned the word several times, volunteering, but there is I don't know what eldsjäl would be in Swedish, but it is precisely what you've been doing.
Well, basically, it's I would say it's a competition where all the people that are able to be nominated are all part of some sort of organization. Most of the organizations are within, youth culture and sports, but it's all to do with organizations in general.
Right.
So you've got other winners. It might be someone who's a local basketball coach, or someone who's a scout sorority president, or someone who's people that are doing social work, unpaid social work that is just going a little bit above and beyond, where you're passionate about something. And eldsjäl, if you were to translate it, it's fire soul, which sounds super corny and really stupid in English. It's like stupid, but someone who's passionate about doing what they're doing. You're burning for something. You got passion for something, but it's outside of your normal scope, your normal profession. It's not something that is, you don't work with this necessarily. You do it outside on your spare time.
So thinking about the benefits, I'm just curious to find out what sort of benefits has it brought to the organization and then to you personally?
Well, I think and I hope that for the organization, it gives people a bit of inspiration and, just for new members to find out that, all right, there is an organization that exists like this. And if you want to be involved later on, maybe right now you're going through chemo, maybe right now you just recently been diagnosed, that, okay, well, look, in a few years' time, you will find that your life is going back to normal-ish. It's finding a new normal, and there is going to be opportunities for you to help others, and that is something that is good. And then, of course, for me personally, I spend a lot of time doing this because I really, really believe that it makes an impact. It takes a lot of time away from, time that I could be spending on trying to pay my bills, to spend with my friends and family. But at the same time, I joke about it sometimes. I don't golf. Anyone who's into golfing spends almost a half time doing that, half the life doing that, and I don't do that. I don't do any other typical sports or anything like this. This is my hobby. But yeah,
and the hobby has now taken over
quite
a bit, and good for you for doing that. And at the same time, I can well imagine what that would be like in terms of a regular income and the kind of income that you used to earn. And don't you get any allowance from government to do something like this, to support you in the actual role?
Very little, incredibly little. And it's very difficult to plan around those. It's very tricky rules when it comes to what you can apply, what type of grants you can apply. It depends on who's in charge in politics. It depends on, those grants are very much from year to year. And to be honest, we haven't had that knowledge locally. How do we go about finding those grants? How do we go about finding what money we can get?
And seeking grants, of course, require a little bit of skills.
Yeah,
how to be successful in grant applications.
It is a tricky part, because obviously there's a lot of different social work being done, and I think a lot of what we do should be subsidized a lot more. So we're going to get better at that. But we've just been super busy with doing all the other stuff, because it's it's a very operational role hands-on. That I've got. It's very hands-on.
Yeah. We have talked a little bit about the women and what kind of support they can get if contacting the association, but also ideas that what can they do themselves. I'm thinking about, the initial, I understand what you were saying, but have women spoken to you about their initial thoughts when they got it? Do they all go through same kind of things, fear?
I think we're all very, very similar. Even if we're all very different, and I'm not trying to, say all women that we're all the same and we're all part of this organization, there's some sort of cult or whatever, because we're all very, very different individuals. But I've spoken to so many people calling, ringing. The people that are ringing our support line is usually someone who is thinking about visiting a doctor, who's found something in the lump, like something in the breast, or someone has been to do a mammogram and is now waiting for the test results. The waiting part before you are enrolled, before you properly, and before you have an answer, it's usually that's where you have the most anxiety. And that's something that I can absolutely relate to myself. It was actually worse before starting operations, before chemo, before all of that started. I think on a mental note, that was my worst part. Once you actually start doing all the other stuff that is horrendous in many ways, it was still, psychologically, it was easier.
Because you are actually doing something.
Yeah, you take steps. And there has been research done on this as well, where you've seen that just looking at how do we feel mentally, that you usually feel worse before you start chemo, but then once around 2, 1, 3, 4, 5, you start feeling better because you do something and you can count down. It's like you can sort of tick the boxes and go, okay, now we've got 20 more days or 15 more days, and it's something you can count down. It's very tangible, and I think we sort of look at that, and I believe as well that's why so many people are looking at maybe alternative treatments, and they look at, forums for what can I eat, what type of food should I be eating. I'm not someone who's very pro that type of discussion, because I believe there's such limited research based on those type of things. But I can understand why you would be looking at alternative things, because you want to be able to control your own life. You want to be able to do something.
And it's amazing how you kind of believe in this kind of pseudoscience that is not really based on the research or the hard sciences. And I suppose it's like, I don't know, but I cannot well imagine myself going on Google and finding out what is this, and then I will start eating that.
Yeah, but I mean, fair enough. If it makes someone feel better, by all means, placebo is very real. As long as it's not something that is contradicting your other treatment, as long as you don't turn down other traditional treatment, as long as it's something that doesn't interfere with your other medication, I mean, go ahead, but I don't believe in it so much myself.
Yes, and I'm sure that your association maybe have even discussions about that.
Oh yeah, this is a recurring topic, and it's something that we talk about all the time. And then when it comes to science and pseudoscience, I mean, a lot of things are not scientifically proven. Doesn't mean that they don't work. It just means that you haven't done the research, you haven't got the facts. And then you have other situations where we have facts, we know that something works, but then it becomes a political decision. Who gets this treatment? Who gets this? Who gets this allocation? Even if we know it works, because if everything was 100% scientifically based, we would have the same type of healthcare and health regimes everywhere.
Exactly. What about the families? What about the partners, family members? What can they do to support in a situation? What kind of advice would you give to them?
I think it just really depends who the person is that is sick. But I think the best thing you can do is not be scared of talking to whoever is going through this, to try and learn as much as you can yourself, and also know that there's a lot of questions you might have that the person is not able to respond. They might ask, okay, so this is going away now, you're all well now, or what's happening next? And that can be frustrating, because a lot of times you don't know what's going to happen, you don't know what the next step is, and the doctors are not going to be able to know everything either. But being there, not being scared of reaching out. I think a lot of times what we find is people, after having, a diagnosis or any kind of other big tragedy happen in their life, it kind of weeds out. There's a shift in who you spend time with afterwards. There's a shift in who do you see as your close allies, and who did you believe were your close friends turned out to not be the ones able to support you.
A lot of times that is, of course, based on fear on their part. They don't know the questions. Yeah. They don't know how to speak to you or ask you questions. And the vulnerability, they might, as I said, I believe that there are people who are too afraid of our own fears. Yeah. If you were to, coming to the end of this wonderful podcast and conversation with you, what kind of, if you were to send out a message based on what you have brought, what we kind of touched on, what would that message be?
Wow, there's a lot of things there. I know for me it was very important to read up as much as I could about the actual diagnosis, the actual treatments, different guidelines, to know what is the absolute latest research. And for me, that was the right choice. I did that. And I think if you have that sort of mindset, if you are able to do that type of research, you should definitely do that, because it can calm you down, but it can also mean that you can take control of your situation. You can have different discussions with your doctors, and you might be able to impact quite a lot of the decisions that are being made. If you're not keen on doing that, then make sure that you speak to other people. Have some sort of outlet that gives you comfort. And also for anyone who's nervous and who feels like they have something going on, it's much, much better. I mean, if you have some kind of cancer, if it's breast cancer, we're talking breast cancer now. So if you have a lump, go and have it checked out, because it's not going to go away by itself if it is dangerous. It will just get worse. You're much, much, much better off finding out early. And if you're worried about finding out that you have cancer, it is worse finding out later. You are much better off just finding it out now, and hopefully it's nothing, and then you can put that to rest and you can put your mind to ease.
Wonderful. And what's next for you?
Well, I've just recently started my own company. I did that last year, and I'm hoping to be able to, do that in a way where I'm comfortable on a financial side, but also on a time aspect line, because I want to be able to choose 100% the different topics, the different subjects that I go into, and that I'm able to impact and to be able to impact the healthcare in Sweden, guidelines, and to work together with our organization and also national and international, and also with other patient organizations. I want to really be able to dig deep into that and be more and to work more with those questions, because there's a lot more to be done.
It's been absolutely wonderful having you on the podcast, Alexandra. Good luck with everything.
Thank you very much.
And I'm sure you will be back later on when more things are happening in the area, and especially because of your interest in the research.
Yeah.
So I'd love to hear more about it. But meanwhile, take care of yourself. Thank you.
Thank you.
And you have been listening to the podcast Sånt är livet i Sverige, or in English, That's Life here in Sweden, with me, Lisa Uusimaki. Till next time, take care of yourself and each other. Bye for now.